Palliative is a totally different type of care and revenue model. Palliative is visit-based. It's just like a physician practice. So it would be just like going into the doctor's office and seeing the physician for a visit. And you would pay your 20% copay if it's Medicare or commercial. And then usually Medicare or even Medicare Advantage patients have a supplement. So those claims go to your primary payer first, and then the balance goes to the secondary payer or to the patient if they owe it, and maybe to both depending on what the secondary payer pays. Palliative is different, and it's a Part B benefit. Home health and hospice are both Part A benefits. So there is no deductible or copay for straight Medicare. When you start with the Medicare Advantage plans, that's where contracting is extremely important, because your contracting dictates how you're paid. So for hospice, I know that in the VBID pilot program, those hospices who are reaching out to credential and become network providers for those Medicare Advantage plans, they're seeing that most are offering a percentage of Medicare. So whatever the Medicare reimbursement is for those dates of service, they'll pay you 95% or 90%. So that's kind of straightforward. You really kind of understand what you'll get paid. On the home health side, it can vary quite a bit. Some pay exactly what Medicare pays. Some pay a percentage, a little bit of a reduction. Some pay by the visit. You know, it all depends on the structure of your contract. So it definitely varies. Now, the difference between getting paid for home health and hospice, it's totally different payment models. While it's a 30-day or a monthly claim, hospice is a per day rate based on the level of care. Home health is PDGM, which is a calculation score based on the severity of the patient's illness and their abilities, you know, to care for themselves and get around. So there's functional and clinical scoring, so to speak, that determines what that 30-day payment is. So that's for Medicare, and then it translates over to Medicare Advantage. And then there are some Medicare Advantage plans for home health that look at what that score is and what that calculation might be for 30 days, and then also look at your charges per visit on the actual claim and pay you the lesser of the two. Contracting gets much more complex with home health.